As an athlete, we're always looking to progress. It doesn't matter whether it's training or rehab, we want to constantly see the numbers improving. However, doing more can sometimes be a real struggle. More reps, more running, more gym work, more volume, more intensity. Adding in more of these things is often when pain flares up. In today's video, I'm going to show you why flare-ups happen when your training increases and what you can do about it so it doesn't continue to rob you of training joy forever. Okay, the first thing I want you to remember is that when you're doing rehab especially, but often in training as well, when you start to push the needle, flare-ups are super normal. They happen to everybody at some stage. So don't think that you're an outlier and that this should not be happening to you. However, the problem arises when most people try to increase their training volume, intensity, or frequency without any real good reason to do so. It often comes from this boost in motivation to try and look for quicker improvements in training or rehab, or like you've signed up to an event that you want to do really well at, so suddenly your training volume spikes. And the common problem here is that we're thinking more work is going to equal better results. And often it does, as long as you can recover from that work. If you're not recovering from it, then we're getting worse results. Now remember, flare-ups in pain do not necessarily mean that you are fragile or broken or that you've re-injured yourself. Most flare-ups do occur because you've increased your training load faster than what your body has been able to adapt to it. The first thing I want to get out of the way, the definition. What is training load? Training load is a broad term for how much work your body is doing during training. And this is going to include things like how many sessions you've been doing, how many reps you're doing, what distance you're doing. You have to remember it's the total accumulated load across a session, across a week, across a month. It's not so binary to each individual session. So it doesn't mean that you do this much work, then you recover from it, and you do this much work, then you recover from it. It's something that is progressive and accumulated across multiple sessions, multiple weeks, multiple months across the training cycle. The major mistake here when we're trying to increase training load is that we're increasing too many variables at once. So for example, if you've signed up to, say, a marathon, you want to run your first marathon or your half marathon, and you're currently sitting at like a 40-kilometer total distance per week. Now you've decided, all right, I need to start bumping that up to 70 or 80 kilometers per week. You've just jacked your distance right up compared to where your current tolerance is going to be, but you're probably going to start increasing your intensity too, because you want to start pushing a little bit harder and getting more out of each training session. And you might have even bumped up your frequency there so that you can fit extra running sessions into the week to get to that total distance that you're trying to accumulate. And on the flip side, if you're training hard in the gym and suddenly one of your buddies challenges you to want to be able to bench press more over the next 6 weeks, you're going to start bench pressing more in terms of how much you're doing every session. You're going to start bench pressing more frequently throughout the week, and you're probably going to start jacking up how much weight you put on the bar because you want to accumulate as many heavy sessions as you can to get more out of that. And the other one that I really commonly see amongst rehab athletes is returning to competitive sports, but you're not allowing your other training volumes to drop down to account for that. Suddenly you've got this really high spike in load on the weekend when you're playing, but then you're keeping your load high during the week as well, and suddenly everything's just this big high load day and you don't have any down days. And these are all examples of sudden spikes in training load, and your body often doesn't handle those very well across an accumulated amount of time. So if you're going to do these sorts of things for multiple weeks or months, it's going to hit the fan eventually. But if you are appropriate and smart with your progression, your body can handle that loading well if you slowly work your way into it with appropriate adaptation. So when you try to progress, why are flare-ups happening? This is really common when you're already training at your ceiling of what your body can tolerate. So therefore, if you do slightly bump up the training load a little bit, you've already crossed the ceiling of that tolerance. And when you cross that tolerance ceiling, we're increasing things like tissue inflammation and irritation. We're accumulating more fatigue as well. And that's when we start to see symptom flare-ups. And what we need to be doing here is changing our thought process to start thinking along the lines of, how can I recover from this workload repeatedly, rather than, am I just going to handle this workload today? How can we avoid flare-ups happening in the first place? Well, the honest answer is that you can't always. They are normal, remember that. But we can minimize how much a flare-up happens in terms of intensity and also frequency by taking these following steps. Step 1, establish a baseline first. Give yourself a consistent training stimulus so that you can start to understand if your body is recovering from it repeatedly. So you might want to hold your training steady for a few weeks. Don't increase it, don't decrease it, and just see how you're recovering from that. It gives you an example of how accumulated loading is going to affect you, not just session to session. And this is because we want symptoms to stay manageable and we want recovery to stay as predictable as possible. You have to remember that if your training is chaotic, there is no way that you're going to be able to track and progress on that. Step number 2, only pick one variable to progress with at a time. You're going to pick from volume. This is how much you're doing. You're going to pick from intensity, which is how hard you're doing it. Or you're going to pick frequency, which is how often you're going to be doing it over, say, a week, fortnight, or a monthly basis. Now, when you do decide to pick frequency to progress with, you have to be very careful with that, because if you're someone who is only doing, say, one running session per week, and now suddenly you're going to add in a second one, you don't want to suddenly just match the same amount of work you're doing in that one session to 2, because you've literally just doubled your workload. So if you're running a 5 or a 10K here, and now you're running a 5 or a 10K here, that is a 100% increase in work. So if you are going to go down the frequency path, make sure that you're going to have one larger session and then one probably slightly smaller session, or even a lot smaller session, just to start getting your feet wet and making sure that you're recovering from it well before you start to push that one up. Step number 3, make sure that you're progressing smaller than what your motivation wants you to. When you're feeling good, motivation usually gets really high. And what you want to do here is make sure that you keep feeling good. If you're feeling good, that is not an excuse to then suddenly start adding a heap of extra work to your training load. This is where most people make the mistake, because they feel good and they associate that with then being able to handle more work. So they bump that workload right up, and suddenly symptoms flare up, and then your motivation is straight back down into the pits again, and you don't want to train anymore because everything hurts. Do not progress aggressively. Make sure that you're making slow, incremental improvements over time, because these are the things that compound into big gains in the long run. Step number 4, make sure you're allowing time for adaptation to happen. Your body needs repetition before you start to progress. And like I've said before, you don't have to progress every single session. You can keep the loading consistent for multiple sessions and even multiple weeks before you need to make an adjustment. Because the important variable here is making sure that you're recovering consistently from that accumulated loading. Keep it predictable, like I said. Step number 5 is you need to properly monitor how your body is responding. Make sure you're focusing on how your body feels during a session, how it feels after a session, and how you're feeling the next day. This will give you the objective data to see if fatigue has accumulated and if your performance is improving or if it's dipping. And remember, one session where pain slightly increases is not a failure. We need to be looking for trends across multiple sessions and across weeks. How you're stacking things up over the weeks and the months is what matters most. So the 4 common mistakes that I see when someone comes to me and they're having trouble with flare-ups on the regular. Number 1 is making these big jumps in training load when they're feeling good. Just remember, if you're feeling good, your confidence is going to start to go up, and it's going to go up relatively quickly. But confidence is always going to outpace your tolerance for activity. So make sure you're not chasing extra work just because you feel good. You have to keep it calculated. The next thing I want to point out is that when someone comes to see me for rehab, they'll often want to add their rehab work on top of an already relatively high training load, even if that training load has been modified because of pain or injury. What we're forgetting is, though, when we do this, is that total training load is what matters the most. So if it's coming from multiple different angles, you need to account for that by pulling away some of the other things and then putting those eggs in a different basket. The individual things, yes, they matter, but the total is what matters the most. The next mistake is ignoring life stresses, okay? If you have poor sleep, the nutrition is not fantastic, or your work and life stress are really, really high, or a combination of all of these things, you're not going to be able to handle as much training load because the stress is already high. So we need to account for that by adjusting training as necessary. If you can keep all of those variables in check, you'll be able to handle more work because you'll be able to recover better. Mistake number 4 is panicking when a flare-up happens and then taking complete rest. The biggest issue here is you start to run into that boom-bust cycle that I've spoken about so many times that is a massive issue for people. It throws out your consistency and it throws out your ability to track how you're going, and it throws out your ability to actually make meaningful progress. So with all this information, to use it properly, you need to understand what a good progression should be looking like. And here's the thing, it's going to be slow, it's going to be gradual, it's probably going to be a bit boring, and it's probably going to be quite monotonous. But the great thing is that you're in control. It's consistent, it's repeatable, and you start to get a clearer vision of what the outcome is going to be. The thing is that good rehab is going to often be slower than you want it to be, but for the best long-term success, it's going to have to be that way. Increasing tolerance comes about from accumulated work that you can recover from over a period of weeks, but probably more realistically, months. And potentially, if you've been dealing with a really long-term issue, it's probably going to be years. If you do have a flare-up, try to reframe the way you think about it. Not every single time you feel pain means you're damaged or broken. And therefore, you can start to understand that not every single flare-up is a failure. You can use flare-ups as feedback. It gives you an understanding that your acute loading has just outpaced your tolerance to what you can handle. And if that's the case, make sure you adjust the program appropriately if necessary. Don't just abandon it and quit, because like I said before, you're going to fall into that boom-bust cycle and you're never really going to get anywhere. Most people do not struggle because they train hard. They struggle because their progression outpaces their ability to adapt. However, the big thing to remember here is that if you can manage progression well, your body is going to become a lot more resilient over time. Now, if you're a runner or you play a sport that involves a lot of running, but you're struggling to stay injury-free because of the running, you can watch this video here because I'll show you how to get back to running strong again without re-injuring yourself.